My name is Huynh Ba Huy. I'm a representative for Eye Care Foundation in Vietnam. Regarding the difficulties in eye care in Vietnam nowadays, I think there are three main problems. First of all, is the human resource. In general, in the remote areas at the lower level, and then the eye care staff who have a good capacity, good skills on eye care services is very limited. The second one is that the facilities, including infrastructure and also the medical instruments and equipment, very lack. And also in the country, the eye care program is not a priority because although you may hear that it's the economic is growing, but it's still poor countries, the developing country, and the government pay more attention to other dangerous disease like HIV, like tuberculosis, communicable disease in general. So it means that the budget and the priority paid for eye care is very limited. This year, Eye Care Foundation will celebrate our 30th anniversary. But in Vietnam, Eye Care Foundation started supporting in 1993. So from the beginning, the Dutch team, I mean the ophthalmologist and also the nurse, come into Vietnam to help the eye care to operate mainly for cataract operation. And then after time, the Eye Care Foundation help training for eye doctors and nurses and human resource staff there. And then from 1993 until now, so many patients get benefits from the project, from the organization. More than 10,000 patients who were operated in Vietnam, and also with the few years ago, the number of school children who got refractory errors receive the treatment, receive examination, receive for poor school children, they got free spectacles from Eye Care Foundation. When people who are living in remote areas, and then the communication for them is very limited. They don't know where to go to get the eye care services, and that's one of the things Eye Care Foundation have to support to increase the knowledge and also increase the communication to the people who are living in remote areas. The most memorable case for me, and I think I never forget it, is in 2009 when the Dutch team come along to Vietnam, and then I accompanied them to a province in the Mekong Delta of Vietnam. And then when we organized an eye camp there, at the first day we did a screening. And then a young lady took the blind, totally blind old lady to come over. The young lady said that this is my mother-in-law. She totally blind many years ago, but because my family was very poor, so we didn't think that there are some ways to help her. And then, at that time, Dr. Henry directly examined her, and then he decided to operate her the next day. And then after next day, when we cut it off her bandage on her eyes, and then I cannot forget that moment. She like a newborn, because she said she never think that she will see it again. So now she can arrange everything at her house, and then I myself visited her twice after the operation. Very happy now.
Really changed her life.
Yeah, it totally changed her life. And also because her son and her daughter is still very poor, so they in the past they take care of their life, also take care of her, spend their time, spend their efforts. But now, after operation, she can do everything by herself, and also she support again to the family.